So who is the typical client that wants your program?
There actually are 3 different categories of doctors that would like to use my program. Number 1, doctors that are performing more full mouth dental procedures. They want to be able to care for their patients in a better manner. So they want to be able to be sure that their patients are candidates for dentistry, so they want to evaluate their medical histories more accurately. Number 2, a lot more dentists are doing sedation procedures, so they want to make sure that their patients are candidates for sedation.
All right.
Number 3, their staffs are coming to me and saying, we see patients that are medically compromised. How many more patients are we treating that have high blood pressure or diabetes or on multiple medications? The average patient is on 5 to 7 medications for high blood pressure, cholesterol, diabetes, respiratory disease. These are the patients that want to be treated. And let's be honest, we want to be treated like physicians of the mouth. So let's be knowledgeable, like physicians of the mouth.
Who needs this the most? The oral surgeon, the periodontist, the general dentist, all of the above, or just the dentist that deals with that older population?
Randy, our profession requires us to have yearly training in basic life support, in OSHA compliance, in HIPAA, but our profession does not require us to have emergency medical training. Our profession—
That's interesting to me. Very interesting.
It is. Our profession doesn't require us to have training in medical history evaluation. Our profession doesn't require us to do anything other than update.
So why aren't all dentists doing this? What's your take on it?
My take on it is, number 1, they don't see it as a valuable use of their time, because how many of them have
So they
actually—
don't see a need. Is that right? Is that what you're saying?
They don't see a need, because how many of them are really honest with themselves and say, why would I train on an event that may not happen to me? And this is the bigger issue for me. They see the solution as picking up the phone and calling 911.
Okay.
But our profession requires us to be able to maintain a medical emergency for 5 to 7 minutes. So conversely, the average response time is about 10 minutes for most emergency assistance in an urban setting, for 10 minutes. Okay, so we have to maintain it for 5. It doesn't get there for 10. What do we do for the other 5?
Okay.
If we don't have the training, what do we hope?
So they don't see a need, but I don't think they know that statistic. Do you think that 150,000 dentists, and every 10 years 8 emergencies happen? Maybe because it hasn't happened to them?
Well, if it hasn't happened to them, it has happened to one of their colleagues. I've owned 2 group practices, and not only have we had emergencies happen in my group practice, but I've been the one to care for the emergencies for my colleagues. So what did my colleagues do? They raised their voice and called for me, and they left to go home for the day. Now, each one of those were managed uneventfully, but after each one of these emergencies, when I shared the event with my colleagues, they also said to me, well, let me tell you what happened to me.
Okay.
And as I began to share this kit of simple tools with my colleagues, they said, let me tell you what happened to me.
But your current base of clients, okay, fairly new company, is it those people that have already had a medical emergency?
It is. It absolutely is.
Because they're the ones that see the need. They're going, boy, I need this. Right?
And what's also interesting is, as I've provided IV sedation services for my clients, I have provided them with this training. And each one of them has said, either they or their staff have said, oh my gosh, this is amazing. We have not
2 days a week, by the way, we should mention, you are doing IV sedation all over Texas.
Yes, I am.
And for those, you are offering this program included. Is
I
that
do.
right?
I do. And not only do I offer the kit, but I offer to replace the kit that they have. So I'm doing an even swap. Give me what you've got. I'll repackage what you have in this format. So I'll take what you don't need, eliminate it, check and see if your drugs are, if they're expired, if they're within expiration date, and most of the time they're expired. I'll package them in this format. I'll train your staff. I'll teach you how to utilize that. I'll evaluate your medical history, and the results have been life-changing for them.
So every one of your clients that you've been doing this with, everybody's pleased?
I've had no complaints. And we've started a support group for the group that we're in. We started a study club, and I'm also available for ongoing consultation. I've checked on them to see, have you had emergencies that you couldn't handle? what's been the status, and the results have been.
So your client is really every dentist in America.
Well,
maybe Canada or everywhere else.
Well, I've cared. It is. I've cared for.
I mean, do you think that everyone needs this?
Let me say this: if the doctor has been honest with themselves, if they've spent a modest amount of time with me, and I'm talking about the course is 6 hours, there has not been a dentist that has left with more peace of mind than how they went into the course with. We're talking about a 6-hour education, 15 minutes a month to inventory their equipment and supplies, 15 minutes a month for ongoing training, because what we've proposed is 15 minutes a month to review an emergency or two, a scenario.
Okay.
And what I propose to the doctors is that the staff do the reviews. So the staff becomes responsible for the emergency review, and that has been so wonderful for them. They love being responsible for that.
So take me through the process. A dentist decides, I want to be part of this program. What happens?
Absolutely. Randy, I make it so simple for a doctor and staff to learn about medical emergency mastery. We schedule a few minutes at the doctor or the manager's convenience. I find out what they're currently doing. They can speak to me on the phone or send me some written information. I find out what their goals and objectives are, the number of staff members that they have. I'll send them some information about the equipment that they currently have.
Okay.
Then we schedule a time that's good for them for me to come into the office. So I bring everything that I need with me, find out whether they're like a half day or a full day program.
Okay, and you have fun during these
I have fun. So I
mean, you walked in here, by the way. It was like a public speaker was walking in here, and you just put us all in a good mood, by the way. So this is your style, then.
Listen, I'm going to tell you something. If we don't have fun doing this, because the material itself can be a little overwhelming for the staff,
okay,
but we are here to learn the material and for me to let them know that this material is important,
okay,
but if I don't give them that sense of assurance, then I haven't done the right thing by them.
All right, so you schedule either a half day or full day?
Yes.
Okay,
and
so what happens on that day?
Well, I will tell you this too. The largest majority of my clients are choosing the full day because they know the good stuff comes after lunch, where they are able to put everything they've learned in the morning to work.
Okay.
The morning, they're learning.
Okay.
They're learning, and they're learning fun stuff. Afternoon, they're implementing. The afternoon, they're practicing.
You role play.
They role play. I encourage.
And you tape it.
I do. And I've set up a YouTube channel for them to go back and to look at the fruits of their labor. So they
Give me an example, for example, what one of these role plays would look like.
Okay, let's take the most simplistic scenario or emergency. Let's just use a term we all can understand. And that would be feigning. So the doctor is always going to be the leader of the ship. There's going to be 3 other staff members, and that, in our term, we call them responders. But
responders,
yes,
3 responders.
3 responders. Each staff member has a job, and I teach them.
And you're taping them. So
I
you're
am.
taping what the doctor does, how the 3 responders.
Yes, and
Interesting.
I've given them in their training material what each person's job is. So they're reading it, and I have it on a big board for them too. So this person's job is to do, but you got to come to the class to find out what the jobs are.
Okay.
So they each know their job. And they go through each emergency.
So for example, asthma, heart, chest pain, all the different things that may go on.
Yes.
And you tape each one of those.
I do. We're going to cover 7 different emergencies or scenarios. We're going to cover mild allergic reaction, severe allergic reaction, chest pain, heart attack, hypoglycemia, which occurs so much because we have so many diabetic patients. Feigning, which we talked about as our most common medical emergency, asthma.
Okay.
So as we cover each one of these, we're going to have the doctor is always the leader of the ship, and each emergency responder will have their specific jobs. Now I want to tell you this, it's amazing because even though we work closely with each other, we're not actually used to touching each other. So we have, one of the responders is going to be the patient each time. This is meant to be an exercise that we have an objective where we're going to learn something serious, but at the same time, if we don't have fun doing something, we're really not going to learn the material. So yes, we do tape them. We've already have a YouTube channel that's set up, a private one, of course, and then they're going to learn the material, and they're going to look back on it, and they can use that for their staff meetings, but they can use it to have some fun and realize that they actually learned something that day too.